Hi, I'm Dr. Shikha Sharma, and today I'll be talking about weight loss and Ozempic. I know it's one of the most trending topics today, and a lot of people, in fact, I have seen many people with my own eyes who have been using Ozempic, and I've also seen the changes in them, in their bodies, in their entire persona. So first, let's understand what is Ozempic and why is it so popular. So Ozempic is an injectable medicine, which is the salt is the element is semaglutide, and it has been it has been cleared for human usage for diabetic patients. And how does it work? So basically, it mimics, it copies, uh, and a GLP. So it acts on a GLP receptor. So basically, it is mimicking, copying a natural hormone. And because of that, it influences insulin, it affects the pancreas, controls the blood sugar, and surprise of surprise, leads to weight loss. Now, the question is that how does it lead to weight loss? The weight loss is because the person feels full, because the gastric emptying, that means the stomach empties food slowly, so the feeling of fullness is higher. That means it's affecting the motility, it's affecting the movement of food inside the uh, the the digestive system. Now it sounds wonderful because a lot of people have lost weight and control their diabetes, but there are no free lunches. As they say, there are no free lunches. So what is really happening? What is really happening is that because people are feeling full, they're eating less, so they're losing weight. And because it's affecting at a hormonal level, the insulin, so people are seeing that, oh, the diabetes is controlled, they're losing weight. This is paradise. Now let's look at the snake in the paradise. What is really going to happen? First thing which I've noticed in patients is that the skin is getting damaged. The skin is completely changing. It's a much darker color, but besides the color, the skin is changing. And so much so in some people, it's difficult to recognize them. Typically called the Ozempic face. They have halos under their, they are hollowed out eyes. It's seeming as if there are dark circles under the eyes. The cheek is all going in. So for the first time you see, you wonder, God forbid, has the person got a tumor, or has the person got a deadly lung infection or tuberculosis? That is the way the patients are looking. And then when you investigate, you figure out that these people have been taking these injections. Now, it has caught the industry like a wildfire because everybody is taking off-label Ozempic. What is the meaning of off-label? Off-label meaning the doctor is not even prescribing Ozempic, but somebody who has a weight issue has started taking this injectable and losing weight. And of course, once Bollywood starts using it, everybody wants to use it. Now let's look at the trouble in paradise. What really is the trouble in paradise? So if you really go to the Ozempic site and see the caution or the precaution or the cautionary advisory, it's clearly stating that this kind of off-label use of Ozempic may have a side effect. First, I'll talk about the general side effects, the the smaller side effects, and then about the major side effect, which is the smaller side effect is nausea, vomiting, intestinal problems, bloating, gas, indigestion. Now, all people will say, oh, that's small. That's a small price to pay for losing weight quickly without dieting. But now let's look at when we talk about vomiting, it's not just some people are having mild vomiting. In fact, some people, maybe small amount number, are ending up in an emergency because they're vomiting so much. So you don't know which patient will actually end up in an emergency because they're vomiting so much. Another side effect is low blood sugar. Now, for a diabetic, they would say, "Oh, that's great. I can eat anything and I'll manage my blood sugar." No, but off-label use of Ozempic can lead to hypoglycemia. That means you take that injection, you go off to sleep, and in your sleep, you've gone into a deadly hypoglycemia. Your brain is not functioning because the blood sugar has just plummeted. It's just gone down suddenly. That is one of the side effects of Ozempic. Then let's look at the major side effects. The biggest and the most worrisome is pancreatitis. Pancreatitis can be deadly, fatal, and it is not something one wants to play around with. This is one of the deadliest side effects one can imagine. Another deadly side effect is cancers. So Ozempic has clearly stated that this is a possible side effect, not in all, but possible in some people. Pancreatitis, extremely deadly. Cancers, we all know cancers, we understand cancers. Diabetic retinopathy, that means if you're a diabetic and you're taking this, you may end up with blindness if you are one of those unfortunate ones who develops retinopathy. So, what one is trying to say is if weight loss is the goal, and if diabetes management is the goal, which is actually weight and diabetes are lifestyle disorders, and lifestyle disorders, the root cause is lifestyle. So, if you don't fix that and you're trying shortcuts, these shortcuts can lead to some side effects which can be fatal. So it is very important to understand that there are no free lunches at all. So understanding, and especially the word of caution is do not use Ozempic for weight loss. Do not use off-label Ozempic for weight loss. That's not what it's been registered for. That's not what it's been approved for. It was never approved for weight loss. Ozempic is not for weight loss. So please do not use it because it can lead you into major trouble. And don't be so desperate to lose weight that you can play with your body and your life. So, if you're talking about weight loss, you have to understand. And one more thing which I would like to add over here, because of this pancreatitis possible side effect, it's also important to understand that if you already have inflammation in your body, be extremely careful because this will only get worse. And pancreatitis is also inflammation of the pancreas. So if you're already having high ESR and inflammation, this is not the right choice for you. And you're not the right candidate for this. So please remember that uh, do not use off-label medications, and especially for something like weight loss, which is a multifactorial problem. It is not because you have a digestive issue. It is because it's a lifestyle issue. So for weight loss, it is much better to actually look at personalized understanding of your body and personalized nutrition and following a methodology and slow and successful methodology which can transform you in 1 year rather than trying every few months some new gimmick, the diet circus, all these gimmicks. Go for something which you will understand as personalized nutrition, something which your body needs and which supports the body. The major reason for weight gain and obesity is because you do not understand your body and you do not support and respect your body to nourish it with the right things. So once you fix that, all other problems, including diabetes, will also start becoming better. The so as in Vedas they say, in ancient systems they say, your body is made of food. Fix the food and you'll fix the body. So to fix the food, you have to understand food and you have to understand your body, and you will be able to do it in a much better, healthier way. And the results are also much better. Beautiful skin, great hair, great energy, fit, healthy, and you also save yourself from many other lifestyle disorders. So, with that, I would say if you are tempted to use Ozempic, especially the off label Ozempic, I would say do not do that. Do not play with your body. Do not play with your life, I would say, because there is only one body and one life you get. And to protect and preserve it is something which you should think about. So if you like this video or you want to get more information, like and subscribe because we keep posting scientific information about current trends and topics.